There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
A stroke can often lead to physical disability. It is often possible for people to have had a stroke to recover some of their lost abilities with treatment over time. This is not always the case, however, and some strokes can lead to permanent disability. Video: Blood Pressure Exercises VSL. Some people who have a stroke can have difficulties with memory and thinking. This is called vascular dementia, and the damage done can be permanent, or can even progress. Sometimes a person can have what is called a transient ischemic attack, TIA. A TIA is like a temporary stroke, when the blood supply to the brain is interrupted for a short period. TIA symptoms usually clear up within 24 hours, but they should not be ignored. Having a TIA greatly increases your risk of having a more severe stroke in the future. There are a number of ways to treat the cause of the stroke and to prevent another one occurring. Some strokes can be treated with medicines to break up clots in the brain, and to stop other clots forming. Others can be treated with surgery to bypass any burst blood vessels. Here's how high blood pressure causes stroke. To make you understand stroke better, you should know there are two kinds. Ischemic stroke, no blood. Hemorrhagic stroke, blood present. I'll skip the details of ischemic stroke's physiology and jump into hemorrhagic, since that's the point of interest. If you can look at the blood vessel anatomy, that is, from the left ventricle greater than ascending aorta greater than branches greater than circle of Willer than circle of branches that supplies the brain, you will immediately know how and why HBP, high blood pressure, causes hemorrhagic stroke. So, this patient has hypertension, and this causes high pressure of blood flow, right? This pressure is high enough it measure over the normal 80-140 or 70-120. We are talking of pressures over 100-180, which is high enough. Now, the flow of this blood and at that speed, let's forget about other branches and focus just on the branch that goes into the brain as mentioned above, is enough to cause aneurysm, rupture of a blood vessel, and the culprit being one of the arteries in the circle of Willi. That's the short answer. Not satisfied, so, an aneurysm is also caused by a weakened intima or muscularis layer of the blood vessel. So basically, the lumen of this blood vessel is weak that any slight pressure will cause it to rupture. And speaking of such a high pressure and over time, the vessel eventually ruptures. And now, this leads to some ischemia in the part of the brain the ruptured vessel supplies. And also, that area would be filled with blood leading to head pressure, headaches and or visual disturbance, neurological disturbances and eventually coma if not handled urgently. I know this might still be sketchy. This is the best I could explain. Quite a huggy topic, but I hope you get the point I'm trying to convey. Stroke is a leading cause of death and severe, long-term disability. Most people who've had a first stroke also had high blood pressure, HBP or hypertension. High blood pressure damages arteries throughout the body, creating conditions where they can burst or clog more easily. Weakened arteries in the brain, resulting from high blood pressure, put you at a much higher risk for stroke, which is why managing high blood pressure is critical to reduce your chance of having a stroke. To control blood pressure, see this video.